All right, Kentucky, it is 5 o'clock on this Wednesday, where we are one day closer to defeating COVID-19. Let's start the way that we always start, by knowing and saying that we will get through this, and we will get through this together. So say it with me. We will get through this. We will get through this together. One last time. We're going to get through this. We're going to get through this together. We're going to get through this together because we have what it takes. We're willing to do the acts to make sure that we follow the rules and restrictions, to take everything we learn from being healthy at home and applying it to being healthy at work. So we are 3 days in to our reopenings of businesses. We are starting phase 3 today of our healthcare reopening. And so we've got a lot going on. What that means is more people will be out. There will be more contacts in Kentucky, which means we have to be better than we have ever been so we can do this safely and so that we don't end up in a position to have to pause our economy while we are restarting it. So what that means is we need to be very familiar, and I'm going to throw you a loop, not just the 10 steps to stay healthy at home, but the steps to be healthy at work. With more people starting to go back, I just want to make sure each and every day we are reminding just the basics of what needs to be done to have a safe workplace. And so over the next several days, since we've talked a lot about being healthy at home, I'm going to pick out just one or two of these so that this becomes part of our muscle memory so we can do this safely and still protect one another, give people confidence that you're running a safe workplace, or give confidence to your employees that it's a safe workplace. So I want to talk about the second part, which is the phased return to work. And this is the concept that we can't all come back at once, that gradual phasing in allows us time to reconfigure a workplace, to make sure that we're doing things the very best way, to realize who can continue to telework, which still should be the number one option. And every employer out there, whether they are starting now or whether they are in retail starting next week, ought to have in their mind what this phased return is. And if you're one that just says everybody's coming back on the first day, you're not trying. We need you to try. And those that don't try potentially cause the spike, which keeps us from doing this safely and keeps us from getting the restart and the reboot and ultimately the resurgence of our economy that I know that we can have. So we have our rules for healthy at work, like we have our top 10 rules for healthy at home, but we always talk about the next rule for each, which is to fill out your census. We need you to do this. It is critically important to our future in the Commonwealth. We are still in 14th place, I believe, which means we've fallen some. Just a couple percent would put us up in the top 10. And I think that's a really important place to be, given what the next months will certainly be like and potentially what the next years may be like. Last couple of times that we've been up here, Rachel, I've forgotten the sign language lesson. And it's been very important to us and how we've gone about this to build a Kentucky, and as we rebuild the economy, for it to be inclusive. And not just for folks to have the information about COVID-19, but to also, as we move forward, always remember that this is everybody's Commonwealth. And we ought to be doing what it takes to make sure that everybody's included and everybody can succeed. So today, Rachel's going to teach us safe at work. That's right. Safe, right? Okay, at work. Let's do it one more time. Safe at work. Thank you. All right, so we'll go right into our numbers today. Our numbers are a little bit up, but we have had a significant number of tests that have come in today. It doesn't change my view that we have plateaued. It'll just be part of the up and the down that we see in that plateau. So today we're reporting 227 new cases, 227 of COVID-19. That brings our total number in the state to 7,080, 7080. 31 of those are probable. The others are lab confirmed. Now, that is out of a total number of tested of 117,395. As you'll see, that's a pretty big jump from yesterday. It's as the labs come in. And what we're seeing is our percentages are a little different in our targeted testing. That's where we're doing long-term care centers, where we're doing some of the prisons, and the general population, which are the drive-through testing sites. So it's starting to give us more data and a better look at what the general population looks like versus some of the more vulnerable areas. Our number now, I think, puts us somewhere around 22nd, 23rd, somewhere around that on number of tests that states have done. I'll get that number and ranking for you tomorrow, but it's a significant increase on where we were even just a couple weeks ago, and it's going to significantly increase as we move forward. Again, capacity is not going to be our problem going forward. It's about how we deploy the tests and getting people to come in and to get tested. Our total number of Kentuckians ever hospitalized, 1,835, currently 377. Ever in the ICU, 784, currently 215. Recovered, one of the best numbers, 2,649. New cases by county, 72 in Warren. What we're seeing in Warren County is what many think will be our future. Getting this in control, plateaued overall in the state and having to monitor the state as a whole, but then having hot spots that can start growing and then grow very significantly, very quickly. Our hearts are with the residents of Warren County. I know Dr. Stack's going to talk about this more in a minute, and it's a lot of kids too that are testing positive. It's families. It's all age groups. I'm going to read that in a minute, but let's remember these are our brothers and sisters in Warren County. They need our thoughts. They need our prayers, and they need our help. Jefferson County 28, Fayette County 20. I believe a number of those are from the federal prison. 20 in Kenton, 18 in Boone, 7 in Campbell, 6 in Logan, 5 in Hart, 4 in Floyd, Hopkins, and Ohio counties, 3 in Barron, Butler, and Davis, 2 in Adair, Allen, Bullitt, Hardin, Madison, Montgomery, and Muhlenberg, and 1 in Boyle, Callaway, Edmondson, Fleming, Graves, Henderson, Jackson, LaRue, Leslie, Lewis, McCracken, McLean, Oldham, Pike, and Simpson, and 1 is unconfirmed. Again, I'm just going to read a couple of the age and areas, and these are all actually in Warren County this day, which breaks your heart in what they're dealing with, but just that this can still impact people of all ages. We have a 7-year-old, a 12-year-old, a 9-year-old, an 11-year-old, a 2-year-old, a 9-year-old, a 1-year-old, a 3-year-old, a 7-year-old, another 7-year-old, a 5 and a 9-year-old, another 5-year-old, and a 3-year-old, all in Warren County that have tested positive for this virus. So let's make sure that we don't just take the steps that we need to keep us healthy at home, but also our children. And let's remember that both our children can pass it to us and other people, and we can pass it to our children as well. So Warren County and the surrounding area, it's not just Warren County, is certainly an area that we need to be thinking about and working with. Total number of deaths today are down, or half of yesterday's, but still 5 deaths to report today from COVID-19. These are 5 families that are going to need us. We need to light our houses up green tonight. We need to ring our bells 10 a.m. Tomorrow morning. These are 5 families and communities that are going to be grieving. They include an 88-year-old female from Adair, a 97-year-old female from Boone, an 89-year-old female from Boone, a 74-year-old female from Marshall, and a 73-year-old female from Boone. These are 5 Kentuckians taken from us by this virus. Let's make sure that we remember that they are more than simply an age and a county, and that we believe that while just about everybody has some type of comorbidities or underlying conditions, that COVID-19 played a role in taking them from us before they should be gone. Let's remember those green lights. They're the color of compassion. They remind these families that we care for them, we love them, and that we're here for them. But it's also the color of renewal, meaning the spirit of those individuals is leaving their body and going to a better place, and also that there's a better day ahead for all of us. Race and ethnicity breakdown. 73.57% of all known cases are white, 14.8% Black or African American, 6.27% Asian, 5.21% multiracial, and then it's about 87% non-Hispanic and 13% Hispanic. On deaths, on race, 78% white, about 19% Black or African American, 2% Asian, 2% multiracial, and then it's pretty close to 8% non-Hispanic and 2% Hispanic. Can we put up this one? That's right. So this is broken down by gender. 51% of Kentucky's population is female, 49% is male. So then you see the COVID cases, and those track pretty close. But then look at the COVID deaths that are here. We're one of the only states, I believe, that has our percentage of deaths being higher than the percentage of the population for women. It's just something that we're seeing in Kentucky that we'll continue to watch. So again, that shows you population, cases, and deaths. And when you see any of those lines stick out further than the blue line, it means it is impacting to some degree that portion of the population more than what they make up of the population. Let's go to the next one. All right, so here are cases by age. Now, a couple of things to mention here is that we haven't been testing as many people until recently in some of these age groups. Now, we're seeing, I just read out some of it today, especially in our drive-through testing and otherwise, we're having more kids tested, and that 0 to 19 years old, it's going to grow. I mean, we're seeing that right now. It is going to grow. And based on previous information that we knew or thought we knew about this virus, a lot of kids weren't being tested. And kids are going to need to start getting tested more and more. So again, you look at the population, that's the blue line. And then you look at the COVID cases and the percentage of the population that's made up for. So under 19 is 25% of our population, but right now only 5% of our cases, and thankfully and blessedly, no deaths. You look at 20 to 39. So the cases as a percentage of population track a little bit better, are pretty close to the percentage that 20 to 39-year-olds make up. But it tells you 20 to 40, right? A lot of people are contracting COVID-19. That there's no age that is invincible, and as we see the kids, I think that'll start to grow. Though again, 20 to 39, thus far people's bodies have handled it pretty well, and a very low percentage of the deaths. 40 to 49 is where we start seeing, especially the amount of COVID cases start exceeding the portion of population they make up. So really, once you look at 40 to 49, 50 to 59, you see that's a large portion of the population and a large portion of the cases that are out there. And starting at 50, the death percentage really starts ratcheting up. And then you see, especially why the CDC says 60 and up. This is very dangerous. Look at how much greater the green line is than the blue line. That's how much more deadly it is for this portion of the population. And for our our seniors 80 and up. This is a very deadly virus that is taking a major toll. But that doesn't mean you just look at the percentage of cases. That's a lot compared to the percentage of the population. But it truly shows you how deadly it can be on the green side. Let's go to the next one. All right, so this is another way to show the disproportionate impact that this virus is having, especially on Black or African American Kentuckians. You look at just 8% of the population. In a way, that blue line is pretty small when you compare it to the portion of our population that's white. Cases almost double, and deaths significantly more. It shows you that this gives you an idea, impacting twice the rate, a little bit more than twice the rate of the population. And if you look down here, it also shows that while the Hispanic mortality is lower than the percentage of the population, there's a significant number of cases that are there. So this gives you an idea of how it's hitting different demographics in Kentucky. Let's go to the long-term care facility slide. And our goal is to provide as much information as transparently as we can in different ways each day. I know that there's a hunger for knowledge as we go, especially with the anxiety and the uncertainty out there. And my goal is to try to give it to you in a calm, rational way to where you can see it, you can think about it, you can potentially ask questions so that you know what we're up against each and every day. Remember, we're strong enough. We can take this. We're going to have to work hard. We're going to have to continue to follow the rules. But we're going to get through it. We're going to do it better than anyone's ever done it. We're going to protect one another. Long-term care facilities. This is the hardest slide to look at day after day because of the harm that this is doing to our residents of long-term care facilities. So today we have 20 additional residents that have tested positive, 3 additional staff, 4 additional deaths, all residents, and 3 additional facilities have now had cases. Now, part of why we're seeing these numbers is that there is more testing being done now in these facilities than ever before. And one question would be why? It's because we have the capacity now to be able to do that. We have the PPE to be able to do that, when at times before that wasn't necessarily the case. So I believe in the last week and a half, we've done over 2,209 new tests just with one partnership. In long-term care facilities, we have another 351 over the next couple days, and then I think we're going to be doing close to 3,000 next week, 2,600 to 3,000, depending on how many of those tests that we are able to administer. So what we're going to see in the short term is probably an increase in these numbers, though I will tell you, we are not getting as many positives as we expected in these facilities, with a few exceptions, and that's a real blessing. It is good to see, and it suggests to us that we have a good plan going forward. But in the short term, we do 3,000 tests in these facilities. We're going to see numbers go up, but we're also going to be able to respond so much better, know where our asymptomatic folks are. It's going to be a significant amount of work for everybody involved, but it's the right thing to do, and I believe it's going to help us save a lot more people. I think our plan on testing and how we respond is one of the best in the country, and I want our senior population to know we're working really hard. This has to be especially scary for you. And my parents don't fall in that last category when we showed the bar graph, but they fall pretty close. Sorry, Mom and Dad. So this is something that worries me every single day. I love them just like we love all Kentuckians out there, and we want to make sure that we're doing everything we can to protect them. All right, a little bit of news from here in Frankfort. Today we have named a new commissioner of corrections here in the state. Our new commissioner is Cookie Cruz, who started her public service 36 years ago when she was a correctional officer at the Kentucky Correctional Institute for Women. She went on to oversee 4 of our facilities across the state. For the last 8 years, she served as the Health Service Administrator, leading oversight of the medical mission for the Corrections Department. So at a time when we're dealing with COVID-19, this is where our commissioner comes from. 8 years in dealing with health with these facilities. I'm proud to announce that she's our new commissioner for the Kentucky Department of Corrections. It's a challenging time in Frankfort and in our correction system for so many reasons. She's a native of Hardy in Pike County. She's demonstrated leadership, dedication, and knowledge of the department. She's worked long hours, and when you look at the fact that she has been a warden or a deputy warden just about everywhere in our system, perhaps brings the most on-the-ground experience that we have ever had in this position based on experience in Kentucky facilities. And we got a short video from Commissioner Cruz.
Good afternoon, I'm Cookie Cruz. I am honored to accept the appointment of Commissioner from Governor Beshear, and I appreciate the confidence he has shown in me to take on this important role. I've devoted my entire adult life to the Kentucky Department of Corrections, and to say I love this department would be a huge understatement. I've held leadership roles in several areas of corrections and have had the pleasure of working closely with many other divisions. This gives me a wide span of knowledge to pull from in order to lead this department. We have an amazing leadership team within the Department of Corrections, and I couldn't be more proud of their dedication and professionalism. But like the rest of the world, Kentucky DOC have been dealing with the global pandemic. This has been challenging since we are charged with managing an incarcerated population. I've been at the forefront of our efforts, working closely with the Department for Public Health, our local health departments, as well as DOC medical departments. As Commissioner, I will continue and look forward to keeping these relationships, as I believe they're crucial as we fight to reduce the spread of the virus. I realize this is a difficult time for incarcerated men and women, their loved ones, and our staff. We are working hard every day to minimize the health risk, and I promise those efforts will continue. Thank you again, Governor Beshear, for having faith in me. This appointment, this job of commissioner, is a role I've always respected, but I never thought it was possible for me. I promise you, Secretary Noble, and this great state, I will do my best.
So we announced this today at a COVID-19 update because one of the most important roles that Commissioner Cruz is going to be undertaking is ensuring that we are doing everything possible to protect those at Green River. She has been instrumental in the plan as we have changed the housing situation, I think, for the better. We'll be even working with the families that I know are concerned, and I get it. It's a scary time, I mean, as a family member, I don't think anybody could ever, be satisfied with steps that are going to be taken. You're worried about your loved ones, but we're working really hard there, and we know that the individuals that are housed there are more than just inmates. They are people that are loved by their families, and I know Commissioner Cruz knows that and is going to work really hard to do everything we can to protect them. So next, Dr. Stack is going to talk about 3 separate things. He's going to talk about phase 3 of healthcare, which starts today. He's going to talk about an update on this COVID-related inflammatory syndrome that we're seeing in kids, and he's going to talk about the situation in Bowling Green. But I'm going to steal a little bit of his thunder because our 10-year-old was extubated today, meaning he's no longer intubated, and that is just a really good step. And to the folks helping to take care of him at Norton, thank you so much. And when we have a 10-year-old in that position in this state and at this time, it's almost like he's all of our 10-year-olds. And being the dad of a 10-year-old, I was very excited to see that news. Dr. Stack.
Thank you, Governor. So I'll do this in reverse order. So the governor mentioned about an update on the good news for our young patient with the pediatric inflammatory syndrome. So Greg, if you could show that slide. So we're going to take some initiatives related to this pediatric multi-system inflammatory syndrome. One of them is if you call the Kentucky COVID hotline, and the phone number's up there, it's 1-800-722-5725. Whether you are a patient or a clinician, they can be a resource for you. So for family members or parents who want to call with questions or concerns, they'll be able to give you some information over the telephone and help direct you if you need some telephone direction. For clinicians across the state, if you have questions or have a patient you need to consult upon, Norton will have pediatric specialists on backup to provide support and information. From the state level, for the Kentucky Department for Public Health, we are sending out this evening, and clinicians will start receiving it through the normal distribution channels tomorrow, an advisory giving additional information on the condition, and also requiring that if you have a patient who you suspect has this condition, that you report that to the Kentucky Department for Public Health so we can fulfill our diligence in trying to help support the community as we work through this. So I'd like to thank Norton for doing this so quickly and adding to our Kentucky COVID hotline. I think it's a wonderful resource for the community. The second issue that the governor's asked me to address tonight is Bowling Green. We've talked about this. Bowling Green at this time has the second highest number of positive cases in the state. If you look at the counties, 708 positives, I think, as of today. They've been particularly hard hit. There are two hospitals down there, the medical center at Bowling Green, and also Greenview Hospital. I was on a telephone call earlier today with the CEOs of both facilities, our local health department leader in Warren County, who's Matthew Hunt, and also members of the Kentucky Department for Public Health staff, and we had a productive discussion. The two hospitals are collaborating with each other and providing resources. We are also starting to make the arrangements to send student volunteers to help at the hospital. This facility at the medical center is one of the hospitals that received an Abbott ID Now kit from the 15 machines we were sent. We're sending additional test supplies to help support them during this. This medical center at Bowling Green was one of the facilities who received one of the initial 10 cases of the experimental drug remdesivir, so they have that medication at that site, and we're providing other additional support to them, and we'll continue our dialogue and discussions with them to try to help them. I just have to emphasize, the disease is still out there. This is not the common cold. This is a bad actor. When it sets up in a community and it starts to take hold, hospitals can get overrun. This is something that it's absolutely essential people continue to follow both the Healthy at Home and Healthy at Work guidelines, and particularly with Healthy at Work as we move to a new normal. It's really, really important you do the social distancing, that you use your mask, and that you follow the other guidance that we give you. And the third and the final item I've been asked to address is healthcare phase 3. So today is the third of the 4 phases of a healthcare reopening over the month of May. The primary changes for today are that hospitals were permitted to resume inpatient surgeries and procedures at 50% of their pre-COVID-19 volumes. So this means a substantial number of the backlogged cases can now be performed, and patients who have needed care can get care. Additionally, there are still visitor restrictions in force. So when you show up at a hospital or a medical facility and they tell you that there are restrictions, that is correct. That is under the order of the state of Kentucky to keep people safe and minimize transmission of the disease. However, we also respect and understand that there is an absolute need to have family members be able to support their loved ones when they go through these some scary medical procedures or seek care. And so at the discretion of the hospital or facility, there'll be able to be a single visitor per patient subject to their policies. And so if they give you a policy and ask you to comply with it, that is at the instruction of the state of Kentucky and the Kentucky Department for Public Health to minimize the spread of the disease. But now there will be able to be at least a single visitor with a patient to support them. And the last thing I would say is, as we transition back to trying to open more of healthcare, please remember, we've said this all along, though we have said if you would not otherwise have sought care, don't go seek care. We have always said the other half of that, which is if you feel you have an emergency, seek care. And I have to ask and urge everybody, if you feel you have a medical or surgical problem, either through telemedicine, telephone, or if you feel it is an emergency by going to an emergency department, please seek care. We've said that all along, and I continue to urge you to do that. And this now extends to routine care that may be bottled up. If you have children who need vaccinations, if you have other routine care, it's important that you call and you make arrangements to resume some of these activities so that we don't fall behind on important other preventive medicines like regular vaccinations. Thank you for all you're doing. I believe that we will get through this, but we're going to get through it together like the governor says. There's a lot of work that still remains. Thank you.
Thank you. All right, next up is our new testing sites for next week under our Kroger program. So next week, and this is testing locations all this week. Again, look at that. I mean, to make sure that we are safe as we restart our economy, this is exactly what we have to have, and we are excited about it. If you'll just put up the overall Kroger sign-up slide. So starting now, you can register for slots next week at our 4 locations. They're going to be in Richmond, Kentucky, in Mayfield, in Western Kentucky, in Louisville, and in Ohio County. So again, we have Richmond, Madison County, Mayfield and Graves, Louisville, and Ohio County. When we look at both Mayfield, Graves, and Ohio, these are 2 areas where we have seen a significant number of cases. If you look at our overall heat map, what you see in Western Kentucky, we want to make sure that we have the testing that is needed there. So again, those are the 4 locations for next week. As of now, Louisville will be all 5 days, Monday through Friday. Everywhere else will be Tuesday, Wednesday, and Thursday. Make sure you sign up for those slots, at least 400 at each location each day. We've been talking to local leaders. They're excited in each of these areas, and we need to make sure we get people tested. Remember, our goal is to exceed testing 2% of our population every month. That's kind of the minimum the White House believes that we need to have a good idea of what's going on out there in the population and to make sure that we can do it safely. Last update, and then we'll get to questions and try to move through some of this faster as we move forward in the days. You put up the Battelle slide. So if you remember, Battelle is a company, but it's a machine that lets us decontaminate the most difficult PPE to find, which is the N95 masks. This is a program we still have, I think, for about 6 weeks where we can clean N95s, and they can be used by the same individual up to 20 times. It's a really important program. We don't have a lot of signups yet. So dentists, doctors' offices, anybody, if anybody who's using one of those N95s, sign up for this. It'll reduce your overall costs, and ultimately it lets us preserve some of that PPE that is hardest to find. So again, please take advantage of this program. We've already got this set up. We want to utilize every resource we have to the full extent possible. All right, questions today. We have 4 journalists that are here with us. We have Phil, Sarah, Lawrence, and Joe, who have all been with us before. And then we have questions from home. From journalists that aren't in the room as we try to make sure we're operating safely here. And I know you only see this in this room, but if you looked out, you'd see everybody in here in masks, us trying to keep it at a low density, all of the things that we want you to think about when you're being healthy at work or otherwise to try to keep everybody safe. I'll start with a question from Chad Hedrick at WSAZ. Many cities and counties are facing major shortfalls because of the loss of revenue. Russell, for example, is estimating half of the income from their payroll tax will be lost because of the economic shutdown and the closure of Our Lady of Bellefonte Hospital. Is there a plan to help cities, especially in rural parts of the state, that are facing this financial crisis? First, of the CARES Act money that we have received in the first wave, we've talked about making an initial $300 million available to cities and counties. We've worked with KACO, Kentucky Association of Counties, and the Kentucky League of Cities on establishing a formula for what goes where, and we're going to get that moving so that people can get mainly reimbursements from COVID-related costs, and they can also cover portions of law enforcement, first responders, and firefighters with those dollars. But let me make sure we know this moving forward. With the way this economy is being hit all over the country, not just in Kentucky, we must, absolutely must, have assistance from the federal government with our state and local budgets. If we don't, this recession will be worse. We will have a harder time climbing out of this hole. And this isn't a Democrat versus Republican thing, though in D.C. everything seems to devolve into that. But as governors, all 50 of us are very clear that this is a must, and I believe mayors are just as united around the United States. Our budget in the state will be devastated. Every local budget will be devastated without direct help from Congress. They did it in the Great Recession. They ought to do it now. And if they don't, it's the people of Kentucky that'll suffer, and it's the people in America that'll suffer. Now's not the time to be timid. Now's the time to make sure we do what it takes to get our country going on the right track. Phil.
We're still hearing about people with their unemployment claims that they filed in March and they still haven't received any money at all yet, or maybe they received one check and they can't get any more after that.
So on unemployment, where we are now is from March to the third week of April, 88% of initial claims, people who have filed, have been helped. The issues have been resolved, and they'll be receiving their dollars going forward. That number is about 90% for March. But I think one of the things I've been clear enough about is that unemployment isn't just a state thing. We can't just say yes or no. The federal government sets just about every hoop that you have to jump through. So the federal government says if you check this box, you got to go through a whole adjudication process about whether or not you should get it. If you don't provide this type of identification, the state has to do all these different things. And so we've got all these processes that the federal government requires us to do, which unfortunately means that we won't be able to help everyone out instantly, but we are working through as much of that federal bureaucratic red tape as we can, because this is a time when people shouldn't have to wait and they should be able to get that help. Our goal going forward is to do better every day. We know that people need that help and need it faster. I will say, as I talk to other governors from around the country, I think we're doing one of the better jobs, but that doesn't mean anything to that person that hadn't been helped. We realize that. I will own it and take responsibility for every single issue, every single person that needs payment, and I'm going to work my hardest, and our people are going to work their hardest to make sure that we can provide that help. We do have now the numbers down to one portion of that is going to have to go through an adjudication process. There's no way around it under federal law, but our goal is to speed up all those that don't. Any guidelines being set for flea markets? Flea markets can fall under retail. Remember, a flea market can't be densely packed. I like that most flea markets are outside. Inside, there are going to have to be real capacity issues. You're going to have to make sure that each of the vendors in an outside flea market are following the guidelines that are out there. And, sometimes those are kind of looser venues than say, a mall might be. But we need to make sure that we are being safe at those places. And I know that our communities will be. Sarah.
Yeah, so my first question is not about the coronavirus. I wanted to follow up on the statement you issued about the Brianna Taylor case.
Right.
And ask if you had a message directly to the family who has been obviously pretty vocal about their pain, what
Yeah.
they're going through right now.
I'm being asked about a case out of Louisville for a young woman who was worked for EMS, I believe, in the city, named Brianna Taylor, and who was who died in a shooting where I believe LMPD police officers in Louisville were serving a search warrant. I just want to make sure, given and it's always a little dangerous to go off just what you've read in the media, and I know those aren't all the facts, but the facts are what the family deserves. You know, the absolute truth, and it's what the public deserves, and I believe it's what everybody involved should want to see, including any of the law enforcement officers involved. The truth is always the very best answer, whether it satisfies any particular person. And I just want to make sure that we get that we get that for the family, and we get that for the public. I want to have a justice system that everybody can believe is fair and just, and one that is truly blind. And to get there, we need to build confidence. And I know we've needed to build confidence for some time. But in this situation, getting to the truth and wanting to make sure that we have a number of set of eyes on it. So what I've asked is when that preliminary investigation is done, that it be reviewed by the Commonwealth Attorney, the Kentucky Attorney General, and the U.S. Attorney. Again, making sure that that investigation is done correctly. And that's what everybody should want. Let's see. Mike Valente, who we don't have today with us, was hoping to get an update on contact tracing. We're going to have a big update on that on Monday. We're going to go through a lot of different pieces of that. I want to be able to show you the tool that our contact tracers are going to be able to use, the database, and it's so much more than a database, about how we're going to keep track of it, to walk through that and to walk through the structure. I want to be able to do it kind of all at once to give everybody a full picture. It's certainly coming together. One of the challenges is going to be to make sure it works seamlessly with our local health departments, which already do a great job. And I know that's a challenge, and it always creates a little bit of friction, but I know we're all on the same team, even though sometimes it doesn't feel like it, and we're going to get this done, and we're going to structure it in a way that honors the good work of those local health departments, while at the same time providing resources we can move from one place to another, and make sure that we have, especially for areas that become a hot spot, the full amount of resources needed. Lawrence.
Governor, how much is left in the unemployment insurance trust fund? And without federal assistance, when's that going to run out? And then what happens after that?
So I don't have the question is how much is left in the unemployment trust fund. We just got an infusion into it based on our employers and how they pay in. So I don't have today's number, but we feel confident that it will last through the spring and get us into the summer. But Lawrence, that's one area, just like everywhere else in state government, that without direct assistance from the federal government is going to be a real problem. In that area, if the federal government doesn't help us, we'll borrow from them, because I'm committed to helping every Kentuckian to get through this, to make sure we come out on the other side. And by helping people through, we ought to be able to restart and reboot and warm our economy up faster than others. But we've got to have Congress to act, and we shouldn't be waiting weeks and creating that type of uncertainty. That just harms all of our states. Our states cannot and should not go bankrupt. The people who would pay there are our people, our law enforcement, our first responders. If we don't get the budgetary help, it's our kids that'll suffer through lack of services. I mean, this is not a red or a blue issue, a liberal or conservative issue. This is about where we are in America and what we need to move forward. And anybody who doesn't believe me can listen to Larry Hogan. He is the Republican governor of Maryland. He is pushing just as hard as I am, because this is just the right thing to do. So I answered a little bit on the contact tracers. What's the likelihood that reopening the economy in May will result in a second spike in cases unrelated to an increase in testing? The answer to that is it depends on how well we do it. If we follow healthy at work, we're comfortable that we won't cause a spike in cases. If people wear their masks, if folks spread out, if people come back at a lower capacity, if we disinfect and do real deep cleaning, if we avoid contact and stay 6 feet away, and we can do this. We can do it in a way that doesn't cause a spike. But if we ignore the rules, we've seen how this thing spreads. The example we were showing the other day, which was a choir, but could just as easily be an hour meeting with that many people in a room, show that if we ignore the rules, we have a spike. If we don't, if we follow the rules, then we don't. And at the end of the day, and I think as states, we all agree with this, if we do this right and we don't have to repause our economy, if we avoid a spike, that's how our economy comes back the strongest. And the strongest state economies coming out of this will be the ones that don't have that spike, that don't have to pause, and that do this thing smart and not just the fastest. Joe?
I know you talked yesterday about educators being hired to help clear out some of those leftover unresolved claims. I know we talked about in relation to March, but I imagine that's also going to help with April's and May's. But can you provide a little bit more specifics about the number of educators you plan to hire and how that is going to help the state clear out some of these unresolved claims?
So I'll have to confirm the numbers with Josh Benton, but our goal is to double, I think, our number of adjudicators to go to bring in another 250, and our goal is to bring in them from other areas of the state and state government. So we're not paying any more, but the deal with adjudication in different ways. This is going through the tougher claims. And what we've learned through this process is you can't solve something just by throwing more people at them. You got to get good people and the right people. We've learned a little bit of that in answering the phones in unemployment, and we need to do a better job in that. Sometimes just having somebody pick up doesn't necessarily help, especially if you've been calling that many times. And so it's the challenge of getting enough people trained. When I took over, the number of people that were answering the phones were down to something like 9. We had starved in the last couple budgets before I came in the investment that we were making in unemployment, and to go from failing to keep it in a healthy, well-staffed place, knowing that it's needed at different times, to facing what we're doing now. The largest number of claims we've ever seen has been a challenge, but I don't believe in excuses. We're going to make it happen. We're going to make sure we help people. And to those that are out there struggling, we need to do better. Even comparing what we've done to other states and that being favorable, we need to do better. What is the current situation involving the state's food supply chain, and how has it changed in the past 2 weeks? When we look at that, a lot of what we're concerned about are our meat processing and plants. We believe that generally they're getting better because with a couple of exceptions, they've engaged in widespread testing, and that they are cooperating significantly more with our Department of Health here in the state. This is an area that is a hot spot around the country. It's a real threat to that supply. But what we're seeing is, if you're willing to do the right thing, test everybody, make sure people who are sick aren't coming to work, do the deep cleaning. If you got to shut down a couple days, do it, so you don't have to shut down for longer, so the situation doesn't have to get worse. But this is an area that I feel is getting better, even though we have seen a number of cases. Phil?
Some people are wanting to know why bars can't open with social distancing, using the same rules for restaurants on the 22nd.
Well, the question is why bars and restaurants are opening at different timetables. Most states are separating them because you're sitting down at a restaurant. They can delineate your seating. They can move them out. They can control where people go. In a bar, that's really different. And in a bar, I think we can say that enforcing social distancing would be a little bit harder. That doesn't mean we can't do it. It doesn't mean we won't come up with the right ways, but it's going to have to wait a little longer. Now, our bars that want to engage in food service, they want to set up tables outside and have some food service, as long as they can follow all of the restaurant pieces, then we want to make sure that they're able to operate, as a restaurant in that way. Let's just remember, there are a lot of things about this that don't seem fair because this virus isn't fair. The way it can be transmitted, the way that it moves, the impacts that it's having on summer, the fact that we can't see our loved ones, the fact that there can't be visitors in nursing home facilities, the fact that there's only now, in some instances, one person that can come with you when you're undergoing a major procedure. None of that is fair. It's all hard, but that's what this virus does. So we're up against a formidable enemy, but we've got what it takes, and we're strong enough to defeat it. All right, Al Cross. Tuesday, I said there are a lot of people out there, internally and externally, that want us to fail, that want us to fall apart, that want us to suffer big losses. Before that, he mentioned people in other countries, what people in this country internally want such things. I think that there are folks that are out there that care as much about politics as they do to how well we respond to this virus. I think that there are those that want to turn anything and everything into a blue versus red, a Democrat versus Republican issue, and that's just not what we're facing. We had significant divisions in this state and in this country before this, and we just shouldn't now. And that shouldn't be a frame of mind that we want to get back to. There shouldn't be winners and losers depending on your party. It should be the job we're doing for the people of the Commonwealth. This is our chance to move beyond all the pettiness, to move beyond what our politics and our government and so much has become, to move beyond the inability to talk to neighbors based on some of this stuff. This is our chance. And there are some that profit from those types of fights and those types of divisions. There are some that think that that gives them more control or more power, I guess, but it's just wrong. I mean, this is our chance. This is our chance not to just come together and be unified, but to stay that way, to be a better people, to be one people again, that can have civil disagreements, but not like what we have seen in the past. Let's get back to encouraging each other about the ways that we're going about addressing this virus. Let's talk about best practices. Let's stop attacking each other in D.C. or elsewhere. Yep. Sarah, I think you were next,
Yeah.
or was it? Yeah. Sorry.
Okay. So you have a background in law and a knowledge of the law, and I know that a couple of people have challenged certain of your orders on a constitutional basis. So I'm hoping you can kind of address that juxtaposition.
So the question is, with my background on law and folks challenging some of our orders, to comment on that, yes, most of my career I've been a lawyer. I'm proud of how we've done. We're in the midst of a worldwide health pandemic, and I've put in orders that I believe we've needed to save lives. And each of those orders, we believe, are similar to orders that pass constitutional muster in past pandemics. And they are orders that we absolutely know are necessary based on how this virus spreads. Now, we're coming to a point where we can relax a lot of those orders, and with the right guidance and the right buy-in, that we can start doing more safely. But as we are in that greatly escalating curve, when cases were doubling every 3 days, what happened in New York was very possible elsewhere. We saw what happened in Louisiana and what's still happening in New Jersey and other hotspots. We had to take decisive action. Now, weeks, months after that, some want to challenge it in court, and they can do it for different reasons. That's fine. That's what the courts are there for. But I hope each of these courts understands the decisions they make and what it may make possible in the future. If we have significant limitations and we have a big spike again, it may prevent us from doing what it takes to battle that next spike. And all we're asking is for people to do their part. And again, we focus on the 0.001% that disagree. But look at how the state came together, flattened our curve, and not just better than just about every other state. We've never seen this in our history in battling a pandemic. I know the drama makes the news, but it's the unity that's been unprecedented. We always see the drama. We always see the lawsuits. We always see the disagreements, and lawsuits are the civil way to disagree and to take it to a judge. In my lifetime, we've never seen this amount of unity about what needs to be done and getting it done. Have I spoken to state educational officials and superintendents about the upcoming school year? What we have talked about, I've talked with the commissioner, is we need multiple plans as we see how this virus reacts, especially in the next month. Superintendents seem to have been see the flexibility that it's going to take and are bought in to make sure that no matter what the situation is, we have the very best chance of going back to school in person with our kids in the fall. I desperately want to get there. We've got to get in a position to do it safely. That's why we're doing all this planning. And let me tell you, that is my goal, more than anything else, is to try to have this virus in a place where we can send our kids back to school in the fall or around that time period. Lawrence.
Mayor Greg Fisher of Louisville has made it easier for restaurants to expand their outdoor seating into parking lots and places like that. Any concern that could lead to bigger crowds at all? And when will restaurants be able to expand? Because he also expressed concern about their capacity issue.
So the question is, in Louisville, Mayor Fisher is working with us on state roads on expanding outdoor seating for restaurants. Outdoor seating is safer than indoor seating. So we support that, but we got to keep it under control. It can't get so big that we create too big of a density. It can't get so big that it requires so many people that the kitchen is just overloaded, because remember, we got to look out not just for the diners, we got to look out for that staff too. And the mayor has agreed that we need to make sure we do this the right way. So the initial capacity we're starting at can and should expand as long as we do this well. But as we are doing what it takes for the very first time, having to adapt to a very different world, clean in a way that we've never cleaned before, wear masks, adjust the way that we serve, get new types of utensils and menus. This is something we got to work our way into. But I hope everything, and it's not just restaurants that are at 33%, but I hope everything we can work to increase that and to increase that. Now, I will say that Dr. Birx from the White House has talked in many ways about our new normal maybe being 50% of the contacts that we used to have once this is under control in different states until we see a vaccine. That the new normal is still going to have to be fewer contacts, less density. And some of the things they're talking about now that they find important is density in people, the activity itself, and the time that you're there. So in other words, there's a difference if you're one place for an hour as opposed to if you are at one place for 15 or 20 minutes. And so trying to consider all of those things, knowing how this virus works and doing it safely. But I'd much rather be able to open and work up and continue to expand capacity than start at a place where we have to shut it down. Yeah. Last one.
There's a letter sent to the state agencies asking them to prepare plans for budget cuts for the rest of the fiscal year, given the revenue climate because of the pandemic. Where are we at with those plans, and when will they be made public?
So our budget office through John Hicks has asked for draft plans, and that's what they are, draft plans for him to review and for my office to review of potential budget cuts based on what we're seeing now. And this is all very preliminary, and they're called draft for a reason because we haven't had the consensus forecasting group come back in. They're coming back here soon to give us the official numbers that will make up what we have to work off of. Now, we can't have any final plans of any cabinet that when we don't even know what the number is. So that's the next step. The next thing we don't know is Congress going to provide assistance, or are they going to free up the dollars we've been sent for other uses? All of those questions will dramatically change what those plans include. So what you do in these situations is you ask organizations to make multiple plans, including what's the absolute worst. And they can then work back from there. So what they're preparing right now is going to be, I think, very different than the final that we see. Okay, we are through Wednesday, which means we are one day closer to defeating this virus. Let me say that we talk, and we've talked a lot about being vigilant, and it's a tough balance each day. It's a tough balance between wanting to give hope, because there is a lot of hope, because we have shown that we can do what it takes to defeat and to plateau this virus. If we follow the healthy at work rules, there is a lot of hope that we can do this right, restart our economy, and be able to do a lot more even before a vaccine. But there is still an aggressive virus out there that if we don't respect, if we don't continue to think about it every day, and I know that's tough. If we simply want to go back to how things were before, prior to there being a virus, prior to there being a vaccine, that's where we stumble. That's where we fall. So I think that we ought to be hopeful, seeing a light at the end of the tunnel, but vigilant, knowing that our work is not yet done. The greatest challenges in life all take time and take hard work, and that's what we're in right now, the greatest challenge that we have faced, at least during my lifetime. So let's try to be upbeat, knowing that there is an end in sight, but knowing there is more work to be done, and by doing it the right way, again, we can restart that economy, we can see more people, we can do more things. Eventually, we can get a haircut here soon. But we got to be vigilant, we got to be strong, we got to be resilient, and we got to get it done. Now, I got a treat for you here at the end. This is Beaumont and their choir giving us a digital performance, a performance that they couldn't do in person because of this virus. I hope you all enjoy it, and we'll see you at 5 o'clock tomorrow.